So before we begin, I'm going to go ahead and state as a disclaimer that I'm wearing this to get me into character, and I named our patient Mrs. Thompson so that I would have something to address her by. I know she didn't come with a name, so that's a disclaimer. And scene. Hi, Mrs. Thompson. Go ahead and have a seat. My name is Kelsey Mercek. I am one of the nurses who will be assisting in your Mohs surgery. I know that this process can be a bit scary, but I can reassure you that you are in good hands here. We'll make sure that you know as much as there is to know about your upcoming surgery before you even step in the operating room so that you are most comfortable. Let's get started. What is a Mohs surgery? We aim to eliminate all of the cancerous skin cells in a minimally invasive procedure with a duration that will have you walking out cancer-free the day of the actual surgery. Mohs surgery is considered the most effective against basal cell carcinomas, which are mutations in the deepest cells of the epidermis layer. Basal cells are responsible for creating new skin cells to be brought to the skin surface and eventually sloughed off as new skin cells emerge, so it's a reoccurring process. That process is controlled by the basal cell's DNA. Basal cell carcinomas are mutations in this DNA, and you can see how this can greatly affect the infected area. It can just continue to grow and it can get out of hand like most cancer cells do. They often look like open sores, patches, growths, bumps, or scars on the skin's surface. There are 3 doctors who will assist and aid in the procedure itself. They include a surgeon that will remove the cancerous tissue, the pathologist that will examine the tissue sample for more cancerous cells, and the surgeon who will close and reconstruct the wound once the process is finished. So a little bit about the procedure itself might sound a little bit scary at this point, but I assure you that it's minimally invasive. The scarring potential is there. We'll talk more about that later, but it's not a worry at this point. You'll be in and out the day of. It may take several hours to get through the entire procedure depending on how far the basal cell carcinoma has spread. But a little bit about the procedure. First, the doctor will inject the local anesthesia in the location of the cancerous tissue, located right here. The surgeon will then remove the outermost layer of the basal cell carcinoma to be sent to the lab for further examination by the pathologist. This will determine how much more needs to be removed. The incision is covered temporarily as you wait for the lab results comfortably. This may take a little bit of time as they test and stain and look for more cancerous cells. As the surgeon completes the lab work, as you wait, they will determine if there are more cancer cells. The process will repeat if there are until there are no more. The wound will need stitches to avoid infection and further damage to the surrounding cells as well, since it is such a large area. So like I said, depending on how large and how advanced the BBC or the basal cell carcinoma is, the surgery can last for several hours. So you may be in the facility for a couple of hours, so put aside some time for that procedure. With any surgery, there is a risk of scarring due to an open wound. We realize how sensitive this issue may be to you and urge that you follow up with any questions or concerns that you may have during your healing process. Follow the aftercare instructions as carefully as possible, as they will minimize the possibilities of scarring and or reduce it. So we need to go ahead and schedule a follow-up since you will be getting stitches. Ms. Thompson, once the incision is healed, we'll need to have a follow-up examination and removal of those stitches. This should be in no longer than 4 to 5 days, since you are pretty young, and skin is a fast healing tissue since it's constantly being produced, like I said, by those basal cells. The process should not take long to perform, so we can go ahead and schedule this appointment before you leave today. Do you have any questions for me? And see.